All right, all right, all right. Hello, everyone. Dr. Inez O'Brien here again with Easy Living MD, and to talk about pain and inflammation. And there are five major mistakes that people are making when you have pain and inflammation. There are five mistakes you're making that's leading you down to disastrous results, disastrous effects in your life. Because people, they look at the common things for pain and inflammation. You want to go take turmeric, you want to, put a band aid on it, you want to, you know, whatever. And people don't understand there's simple things and they're very simple that once I highlight them for you, they're going to open up a part of your brain and your mind that's going to really help you start being able to understand better how to deal with it, avoid creating these disastrous effects in your life, and in a way that you can actually start to heal yourself. Okay. So, what are some of these mistakes that people make? A big one is people don't think about emotions when it comes to pain and inflammation. Okay? People don't think about that, but there is emotional pain that doesn't have like the actual physical pain. And the big mistake people make with that is they kind of drop it to a different scale because they don't feel it. They don't take it as seriously. Or you go to the doctor and they can't find any reason and they think, oh, she's just being emotional. Um, and just because you're just being emotional, you yourself do not need to get triggered. You need to say, oh, that's just as important, if not more important. You know why? A lot of physical diseases now, people are beginning to recognize the tie to the emotional aspect of things. Things like Crohn's, IBS, autoimmune issues, they didn't just start overnight. They started years ago, energetically, emotionally, and they're beginning to unravel all of that right now. So imagine what your life would be like if you took the emotional pains that you had just as seriously as if you had a physical problem, what you could avoid for yourself years down the line. That's very important. Even as most especially with issues even like cancer. Let me give you an example, even with breast cancer. Reducing stress, emotional reduction of stress. When I say reduction of stress, yes, on the outside, but also how your body's taking it with the emotional responses has more than 80% reduction of like the cancer coming back. Like your remission rate is more than 80%. There's no drug, there's no food, there's almost nothing that can give you that much 80%. Because as that reduction with the emotional stress that your body feels and responds can do, that is the same way on the other hand when it's out of control, it actually creates that. So yes, emotional pain can create pain and it can create inflammation in the body. Think about even when they talk about your immune system and the response of the immune system, right? For things like fear or anger, they have now been able to see that your immune response and system can drop by anywhere from 30 to as much as 70% from these emotions because it creates inflammation and the immune system isn't functioning well at the time. Okay? So it sounds really simple. Emotional pain, yeah, what's that? Listen, take it just as seriously as you're going to be running down to the urgent care. Okay? Take it just as seriously because you will be saving yourself a whole lot of heartache. Don't say, I don't have time to deal with that right now. You don't, yes, you do. If you don't take the time to deal with it now so gets out of the way, you're going to spend your time, your money, and losing out on the true desires you want for yourself for your future. So start taking emotional pain just as seriously. And I will talk about our check medical scan because not only is it able to depict issues in the organs, but it'll tell you if it's still on the emotional scale or if it's actually getting into the physical scale. Yes. Okay. I'll say. All right. So, number two, stop focusing on just one body part when you have pain in one body part. Take your whole body, your whole self as one. It's serious. Because not just with Chinese medicine, but there's different philosophies here. People know about iridology when they look in the eye and they can tell how all the different organs are doing. Acupuncture and the meridians, the teeth can tell you a lot about different organs. And it's the same thing with even musculoskeletal pain. Yes. A lot of joint and muscle issues chronically can be the liver. Go Google it. Right now, go and I know there's Dr. Google or whatever, if you love, whatever, to just go and even check research articles. Joints and muscle pain chronically can be the liver. Yes. And so stop isolating it. I had this injury here one time and that injury here another time, and then this comes here another time. What is going on? They are not seemingly like separated events. So start putting those together. Same thing with things like back pain. That could be kidney, it could be the adrenals, and it could be from fear, anger, resentment in the liver or the gallbladder. Again, tying it back to emotional pain, but stop separating the different organs in the body. They are very important. Even things like shoulder pain all the time can actually be coming from your liver. Certain drugs, medications, or even supplements you take can create pain in your shoulder because it's affecting the liver. Just like dehydration can create pain in your kidneys. Just like some drugs and medications you take, even too much protein you can start feeling some kind of tenderness and soreness in your back, and you think, oh, it's just because I worked out. Some people will work out and they'll have pain in more places than other people would. And sometimes it's actually the organ that's associated with it that's getting inflamed. And then there's a bigger part of all that when it comes to acidosis that also creates its own issues with the different organs or whatever. But that tune in for all of that later. I'll go into more specifics later. Right now, I want you to just start changing your mindset with a lot of this stuff because it will save your life. Okay? Number 3, toxin overload. I say it all the time. If there's one simple thing you can do with your life right now that's going to really change and make a difference for your health and wellness, it's to always, always detox, removing things out of your body, removing things in your environment that might be creating the pain. So yes, if it's that an activity that you do all the time that's creating it, you might need to stop doing it for a while. But detox in terms of detoxing toxins in your body, because those things create acidosis, they create disease, your cells don't function very well, they start to create pain, they start to create inflammation, and reducing pain and inflammation, sometimes you need to detox. And that's why Dr. Ghazi, our doctor of physical therapy here at Easy Living MD, will do check medical scans for some people and see, okay, you know what? This pain you're having, there's toxin overload. This pain you're having, it's because your gut isn't functioning well or it's your liver. And it actually shows for our sports people, heavy athletic people, people that work out all the time. This is very important because when certain muscles associated with organs are having problems, okay, it's a warning because the muscles will start to tear chronically, and you only want to focus on those muscles, but you have to focus on the organs because it will not only you keep having injuries in those areas, but the healing process is going to be a problem. And worse off, the organ is the one having the problem. You're not even tuned into that. So start tuning into those things. And again, I'll talk more about it. I have group sessions coming up. I have challenges that I have coming up now because everyone's asking for this education, that they want to know more about this information, because these are simple things that everybody needs to know that you can do on your own to help yourself. So toxin overload. And you listen, if you know anything about me, when I talk about toxins, I don't mean just what's physical things in your body, emotions, habits, patterns, thoughts. Because again, those things, like my first number 1, emotions, they all tie back and create disastrous issues in the body. Okay. All right. And number four, thinking that this little pain and inflammation is not going to lead to an actual chronic disease. Not to elicit fear, because we already have a lot of fear everywhere. This is to bring you to love and value your body and yourself more. That what is it that you are not loving in yourself, that you have pain, or they tell you have inflammation somewhere, and you just want to band-aid it and keep going. Like what lack of love do you have for yourself to do that to yourself? Why do you not pause and say, I am important, I love myself? And I know this could be a deeper issue. Because a lot of times when we have this going on, our body, which is in great health, is just giving us a message. That's what pain is. That's what inflammation is. That's what disease is. It's the body talking to you. It wants you to interact and do something to keep it in optimal great health. And you don't see it that way. So again, when I talk about you're not looking at something as though there's pain and inflammation to lead to a chronic disease, I'm not saying it's so that you become afraid. No, it's that you love yourself enough to know you want to stay on a path where you don't need to deal with these issues. You know what I'm saying? So that's what I'm saying is even a little bit of pain and inflammation can be a warning for things like that down the line. I mean, look at the effects that's having now. We have young kids, young boys, 15, 17-year-olds with hypertension, diabetes, cancer in young children. I mean, what is chronic now? We used to think it would be when you're in your 60s, but the kids are getting all this stuff now. So even in their 20s, 30s, it's already a chronic issue. So we need to start paying attention to all these little things, especially pain and especially inflammation. Okay, when the body is irritated, the mind is irritated, something in the body is turning on itself when that's happening. Again, not just physically, mentally, emotionally, and spiritually too. Okay? And the last but not the least is your intuition. Whenever there's a nagging thing in your mind, when you get somebody, you feel a pain, you're like, oh, something's making me concerned that this might be something serious. Please listen. Please listen. There's no better doctor or healer than your inner self communicating with you. None. Yes, there's some of us intuitive healers. We listen in and we can hear that. You know where to go to find some of us, and I will put more of that out there. But I want you to learn to do it. And that's why one of my biggest focus, and I will get there, is teaching people how to tune into their intuition. Because it will save us a lot of this heartache with healing and fixing and being sick and chronic care and take this and take that. Your intuition. That's what I talk about the pandemic all the time. That's what the pandemic is trying to highlight here for us. Learn to tune into your intuition so we can evolve past this life of sickness that we've created for ourselves. Okay? All right, so I already talked about a lot of the stuff that I want you to avoid making the mistakes. Don't ignore your emotions. Emotional pains are just as disastrous and can cause all sorts of diseases, cancer, autoimmune issues, Crohn's disease, you name it, hypertension, diabetes, all of it. Don't focus on just one body part. If it's your liver, it could also be affecting your joints and your muscles and chronic injuries. Yes, and there's more. Toxin overload will create pain and inflammation. So while you're busy trying to work on the knee, which even knee issues have been associated with liver problems, go check that on research papers. Yes. But anyway, toxin overload, because I've had to detox people, detox them of dairy, the knee pain goes away. I have a testimonial about that on my Instagram page. Okay, so toxin overload and detoxing, important. And detoxing also, mental, emotional habits, thoughts, patterns that no longer serve you. And stop thinking that a little pain and inflammation cannot lead to a chronic long-term disease. Love yourself enough that you pay attention the first time. And the big one is your intuition. Intuition. There's a reason why this is called EzLivingMD Intuitive Health Center. Okay? And the ways we do that, we can do with our check medical scan because it will pick up energetic imbalances, be able to highlight if it's on the emotional plane, if it's set in the body. Even with the blood work saying everything is normal, we'll still be able to see those things. And that's very important. So if you can, at least get your check medical scan. And we do that here with our bioresonance scan. Okay? Tune into your intuition. Don't let the pain and inflammation sit. Don't ignore it. Don't go for a band-aid when you have a deeper wound that needs more TLC. It is not going to work. Okay? So band-aid is for short term. Don't ignore whatever is going on. Go and find out what the deeper issues are because there could be a lot. Okay? Don't separate the body parts. Detox, detox, and detox. And tune into your intuition. And tune into EzLivingMD for more. Okay, so that would be a lot of our focus this month is on pain and inflammation and all the various ways that it can express itself. And there's so many, so many. And you can go and hang on to these little bits of information that's spewing out everywhere. Or you can pay attention to some simple things that actually take you directly to the source of what is going on that you can do for yourself. That's my mission. That's my goal. That's my purpose. You need help? I'm here. But ultimately, I want you to be able to heal yourself. So you all have a wonderful, blessed day. One love. Ashe.